In males, around about half the cases we just don't find a cause for. But of the ones we do know about, the biggest group are the ones that involve the testes directly. So things like having had mumps as a child, drinking lots of alcohol, smoking, those things don't help with sperm production. And other things, if you've had chemotherapy, that will really interfere with your sperm count. So our advice is always, with males and females, if you have a good chance of needing cancer chemotherapy, have some sperm banked and frozen for the future, and in women have some eggs banked for the future. The other causes that we find with males are obstructive ones. So if you've had something like cystic fibrosis, or if you've had a vasectomy or a congenital absence of the vas, that's a problem, and often surgery is useful in these cases. We have other techniques too where we can actually get some sperm directly from the testis via a needle and use that in an IVF procedure to achieve a pregnancy. The smallest group is ones that involve the pituitary and hypothalamus. So this group might include weightlifters who take a lot of anabolic steroids. This, unfortunately, even though it gives you big muscles, it does give you small testicles and reduces your sperm count. So it's not all good. People who are taking steroids for a long term are also at risk of problems there too. And there are other things like tumours in the hypothalamus and pituitary, and high levels of hormones like prolactin. So again, a fairly long list of things, which is why we do a fairly extensive workup on males to find the cause.